This video is about the problems that can occur with the ulnocarpal joint of the wrist. So this is one of the two joints that can cause pain over the little finger side of the wrist region around here. The other one is the distal radio-ulnar joint, and I've done a separate video to address DRU joint problems, which you can check out up here or in the video description below. So if you have pain over this region, then do watch this video, but afterwards, if you don't think the ulnocarpal joint fits well with your symptoms, then maybe check out that DRU joint video and see if that joint better explains your problem. So I'm Stephen Bunting. I'm a specialist MSK physiotherapist based in the UK. Welcome to my channel, where I discuss the common MSK conditions that affect everyday people and the evidence-based treatments that can help. The wrist comprises of three main joints. The radiocarpal joint, which is what most people think of as the wrist joint itself, but also the distal radio-ulnar joint, and then our friend the ulnocarpal joint, which is the joint between the end of the ulnar bone and the carpal bones of the wrist. This is the ulnar, and the two bones it indirectly connects to are the triquetral and part of the lunate. I say indirectly because this joint isn't a typical synovial joint like the other two wrist joints. It's classified as a complex joint because in between the joint is a fibrocartilage disc called the triangular fibrocartilage complex, or TFCC for short. The ulnocarpal joint works alongside the other two joints of the wrist to produce the mobility, dexterity and precision which makes the human hand such a unique and useful tool. People with ulnocarpal joint or TFCC problems will tend to have pain around the little finger side of the wrist just here, and also sometimes a clicking or clunking feeling when the wrist is moved. And these symptoms can be aggravated by any wrist movement, but particularly rotation and also ulnar deviation, which is the karate chop type movement. And when these two movements are combined, well, that's usually the nightmare scenario for someone with ulnocarpal pain. So things like using a screwdriver, opening a stiff door handle, or using can openers are the things that people will tend to have problems with. And the other common thing we see is pain when leaning through the hand and wrist like this. So the two main problems that can happen with the ulnocarpal joint are you can get a tear in the TFCC, or you can get a condition called ulnocarpal impingement or abutment, which also involves the TFCC, but this time it becomes irritable and degenerative rather than torn. So let's look at TFCC tears first. So usually if you've torn your TFCC, then you will have injured your wrist. You can probably recall a specific injury which probably involved those rotation and ulnar deviation movements that we discussed earlier. So you commonly see TFCC tears in racket sports or batting sports, and also in golf. In fact, I saw a patient only last week who was playing golf and hit a hidden tree root when swinging hard at the ball, and that sprained the wrist and ultimately tore their TFCC. So you can see how that type of thing could squeeze, twist and then tear the TFCC. The other cause of a TFCC tear is a heavy fall onto an outstretched hand. And with both of these injuries, you might just assume that you've had a simple wrist sprain, basically a straightforward ligament injury, and you might only start thinking that there might be something more going on when that sprain doesn't get better over the typical 6 weeks or so. The other scenario I see fairly commonly is after a wrist fracture, which is also commonly caused by a fall on an outstretched hand. But of course the main problem at the time is the fracture, and it's only a few months down the line when the fracture has healed, but the patient is still getting persistent ulnar border wrist pain, that a TFCC injury might be suspected. So that's a TFCC tear, Now let's look at ulnocarpal abutment or impaction syndrome. So this is a condition where the ulnar head impacts upon the ulnar side of the wrist bones, causing pain. It tends to occur as a result of repetitive ulnar deviation activities. That's that karate chop movement that we spoke about earlier. So you could imagine something like repetitive use of a hammer might cause this problem. Now the tissue that will often be painful in this condition is the TFCC, because it's the TFCC which gets impinged between the ulnar head and the wrist bones. But this time it becomes inflamed and degenerative and therefore painful. If you've torn your TFCC, then the diagnosis is usually made with some form of imaging, usually an MRI scan or an MR arthrogram. But sometimes TFCC tears can be difficult to see on imaging, especially the subtle ones, and so a hand specialist may have to perform a wrist arthroscopy, which involves looking inside the wrist with a keyhole camera in order to make the diagnosis. If you have ulnocarpal impaction syndrome, then a history of overuse is important in making the diagnosis, as well as those classic symptoms of ulnar border wrist pain. Imaging can also be helpful because we know that people who have a slightly longer ulnar bone in comparison to their radius have a higher likelihood of developing ulnocarpal impaction. In most people, the end of the ulnar and the end of the radius are a similar length, but sometimes the ulnar can protrude beyond the radius, something we call positive ulnar variance. This can occur as a result of an injury, but more often it's just congenital, meaning you were just born with a slightly longer ulnar, and this can make you more likely to develop ulnocarpal impaction, especially if you do lots of those repetitive wrist activities. The main clinical test that we use to diagnose this condition is the ulnocarpal abutment test, where the clinician holds the patient's hand and then with their other hand supports the elbow, which is bent to 90 degrees. They then take the wrist into ulnar deviation and then rotate the forearm whilst compressing along the length of the ulnar. So this essentially squashes that TFCC. And if the patient's familiar wrist pains are reproduced, then the test is considered positive. If you have a TFCC injury or ulnocarpal impaction syndrome, then the first thing you must do is try and stop the painful activities which are aggravating it and give your wrist the rest it needs to try and heal itself. So if you are doing some form of painful repetitive activity, then you really need to stop it and look at alternative ways of doing that activity. After that, using a wrist splint is probably the best thing that you can do to help support the wrist and promote the healing process. You can buy a standard wrist splint like this, which will do the job, or you can buy a specialist splint specifically designed to offload the TFCC. The wrist widget is probably the most widely used of these, and indeed this is the one preferred by many hand therapists when treating TFCC injuries. I'll put links in the description to the wrist widget and details of how to use it. You can use tape, which will do a similar job, but it's a bit messy and can be a bit uncomfortable if you have hairy arms. But if you want to try that, then I've done a separate video to describe how to apply tape to offload the TFCC, and you can check that out in the video up here or in the description below. Exercises do have a role in this condition, but they should only be done when the pain has settled down enough that you can do them without any pain. Until then, keep on with resting it and using a splint, and it can take a month or two for this to work and the pain to settle down. The type of exercises to then start with are just simple wrist movements to help with wrist stiffness and then to improve strength. For range of movement, just do slow and easy flexion and extension movements. About 10 of each is fine. Then radial and ulnar deviation movements. And finally, pronation and supination movements. This will take a minute or two, and you can do them a few times per day. If you can do these simple exercises without pain, then you can start to do the same exercises but with some resistance in order to try and increase strength. The easiest way of doing this is by using a hammer. You can grab hold of it while doing the flexion and extension movements like this. the ulnar and radial deviation movements like this, and the pronation and supination movements like this. Now, if you've tried rest, splints and then exercises over a few months and you still have symptoms, then the next treatment that might be tried is a cortisone injection. This can help with ulnocarpal impaction and also general irritation or inflammation of the TFCC. After that, the final option is going to be surgery. TFCC tears can be surgically repaired. This is fairly intricate surgery, and so you're going to need to see an orthopaedic hand surgeon who specialises in TFCC injuries. If you have persistent ulnocarpal impaction or abutment, then the surgical treatment is usually an ulnar osteotomy, which essentially involves shortening the ulnar bone in order to offload the painful ulnocarpal joint. Both of these procedures are usually done under general anaesthesia and are followed by about 6 weeks or so in a cast. So if you have a manual job, then you can expect about 3 months off work, and even then you might be on light duties for a few more weeks after that. Okay, well that's about it. As I mentioned earlier, if you do have ulnar border wrist pain and this video isn't ringing true with your symptoms, then do check out the distal radio ulnar joint video that I did recently, as the symptoms can be very similar. Well, I do hope you found the video helpful. Thanks very much for watching. Take care and bye for now.